fist and sits in the middle of your chest, slightly to the left. It's the muscle at the center of your circulation system. The inferior tip of the heart, the apex, lies just to the left of the sternum, between the junction of the fourth and fifth ribs, near their articulation with the costal cartilages. The heart wall consists of 3 layers: the endocardium, myocardium, and epicardium. The endocardium is the thin membrane that lines the interior of the heart. The myocardium is the middle layer of the heart. It is the heart muscle and is the thickest layer of the heart. The heart has 4 chambers, 2 atria and 2 ventricles. The right atrium receives oxygen per blood from the body and pumps it to the right ventricle. The right ventricle pumps the oxygen per blood to the lungs. The left atrium receives oxygen-rich blood from the lungs and pumps it to the left ventricle. Tricuspid valve. This valve has 3 leaflets. They allow blood to flow from the right atrium to the right ventricle. They also prevent blood from flowing backward from the right ventricle to the right atrium. Pulmonary valve. They allow blood to pump from the right ventricle to the pulmonary artery. This artery leads to the lungs, where blood picks up oxygen. Mitral valve. This valve has 2 leaflets. They allow blood to flow from your left atrium to your left ventricle, and they prevent backward flow from the left ventricle to the left atrium. Aortic valve. This valve has 3 leaflets. They open to let blood flow from your heart's left ventricle to the aorta. The aorta is the largest blood vessel in your body. It brings oxygenated blood from your heart to the rest of your body. The aortic valve prevents backward flow from the aorta into the left ventricle. The function of valves is to prevent the backward flow of blood.